As everyone in the field is aware, the recent FDA announcement on November 10th, 2025 marks a pivotal shift. The agency is directing drug manufacturers to remove the long-standing black box warnings on most menopausal hormone replacement therapies, citing newer evidence since what was available in 2002. Some risks, like breast cancer and heart disease, were overstated and have caused unnecessary fear for over 2 decades. We're here today to help set the record straight. This isn't about erasing history, it's about empowering informed choices with updated science. For AquaVitae, this is a chance to acknowledge the valid fears of the past, validate patient experiences, and guide toward hope and relief, a fresh start for hormone conversations. I would like to welcome our amazing group of female providers today to discuss this important topic. These healthcare professionals represent our clinics across our footprint here in the Carolinas and Georgia. Keep in mind that all the information you will hear is for educational and informational purposes only. It's not meant as medical advice. Please consult your own provider for personalized healthcare. All right, the first question is, can you explain in plain English what the FDA actually changed on November 10th, 2025?
I'm Nikki. I am a nurse practitioner in our Fort Mill location. I've been a nurse practitioner for about 18 years, and I am right smack dab in the middle of why hormones were bad. And I think understanding what the FDA actually changed, we have to backtrack a little bit and understand why there was such a backlash against hormone replacement in women. And that goes back to a Women's Health Initiative study in the early 2000s. It was done in around 2002, came out in 2003, that essentially hormones were bad. There was a group of women who were menopausal. They were on an estrogen replacement. They were on Premarin, which is a conjugated equine estrogen. Premarin was short for pregnant mare urine. Again, it was horse estrogen. And then half the group you will hear received progesterone. It was not a bioidentical progesterone that was given, it was a synthetic progestin. In the half of the women who started receiving the progestin, there was an increased risk of breast cancer. So at that time, they stopped the study. Hormones became bad. And so then we've had two generations of women who have been under this umbrella that hormone replacement was negative. In 2024, another study came out that was much more comprehensive. It involved over 10 million women who are over the age of 65 and who have continued their hormone replacement therapy. And what they found in that study was that in those women, there was a decreased risk of cancer, a decrease in overall mortality. There was a 50% decline in bone fractures because of osteoporosis risk being augmented and decreased. There was a 60% decline in cognitive decline. There was a 60% decrease in cognitive decline and a decrease of about 35 to 40% in actual Alzheimer's diagnoses. The FDA in the summer of 2025, Dr. Makary, who is the FDA commissioner, he started going around talking about the results of the study. And he essentially called the results of the Women's Health Initiative study from 2002, 2003. He said it was one of the greatest mistakes of modern medicine in the last 25 years. And at that time, he said, we are going to be looking at this from the FDA perspective to consider removing the black box warning, because they do realize that hormone replacement therapy, when appropriate in women, it is extremely beneficial to decrease the all-cause mortality, to decrease the risk of bone fractures, to decrease the risk of cardiovascular disease. So there was a 50% decline in heart disease in women who maintain their hormone replacement. And then again, that 60% decline in cognitive dysfunction, including Alzheimer's risk.
Interesting. They took some things off of the black box label. Is that what actually happened? And they had a big announcement about it.
Correct. The big thing was with estrogen and estrogen replacement. And they said that when appropriate, it was a good idea to replace estrogen in women. They still have the warning on the hormone replacement products that absolutely says do not use estrogen in women with a uterus unless you use progesterone to balance that. Because when women are using estrogen only and they still have a uterus, then you are increasing the risk of endometrial cancer. With my own personal With what I do and the way I practice, I never use unopposed estrogen, so that would not be applicable in our practice. But women do need to be very mindful if they are starting hormone replacement therapy, that they need to make sure that they are looking at a balance to their hormones. The other piece to it is, again, making sure that women are appropriate for replacement.
I think there was also some language on there that said something about lowest dose for shortest time, or was that correct?
There is some data. What they said is that women who started hormone replacement therapy within 10 years after menopause, then those women, there was a decreased risk associated with it. And we do always want to replace low dose, start out low as we move up when we're doing any kind of hormone replacement.
Oh, awesome. Thank you for that, Nikki.
Of course.
Our next question was, and that kind of leads us right into this next question, which is why did it take 23 years to correct this? And what did we learn after this 2002 Women's Health Initiative study that changed the interpretation?
Can I give an example here? My mother is a byproduct of what happened with this. My mother had a hysterectomy in the early 2000s, and she has been without any kind of hormones now for 25 years. During this entire period, she's been estrogen deficient. My mother, again, only being 67, has significantly increased her. She has cardiovascular disease. My mother's already been in a nursing home. She has broken bones already at 67. She literally is a byproduct of no hormones and that they were bad. And part of the reason it took the 23 years is we haven't done the research in women. We did not have that research. When it was determined to be a negative for hormone replacement, in America, we stopped testing for that. We stopped doing the research. Now, overseas, there's a ton of evidence on the benefits of bioidentical hormone replacement in those women. I lived overseas. I remember over in Europe being told that the way that we treated women with healthcare, that it was barbaric because there was just no data to support women's health and women's health initiatives. After that 2002 Women's Health Initiative, when we started seeing this increased risk of cardiovascular disease, women dying of stroke and heart attacks after the age of 65, women who were breaking hips, and then the risk of mortality after someone breaks a hip is significant. And the cognitive decline with women, it started a lot of those of us who are in this age range now saying what's happening. And a lot of times the research started taking the situation more seriously. And then we ended up with what is now happening where the black box warning is being removed from estrogen replacement and from hormone replacement therapy. One of the things, there was an analysis, there were about 30 trials separate and aside from the 2024 study with the 10 million American women who continued hormone replacement after the age of 65. Basically, Health and Human Services, in their information that they put out about removing this black box warning, even they noted there were at least 30 trials. Their data was 26,708 women who found that HRT was not associated with increased cancer mortality, and women who started the HRT before the age of 60 appeared to have decreased mortality risk.